A racist doctor denies treatment to a black girl, thinking she's just another patient, unaware that her father owns the very hospital she's in. What happens when the truth comes out? Subscribe to see how this shocking story unfolds and comment where you're watching from. It was a quiet Monday morning when a young girl named Leah Carter walked into the clinic, hoping to get treatment for a persistent cough that had been bothering her for days. She was just another patient, carrying a heavy backpack as she entered the waiting room, her eyes scanning the sterile, white walls of the hospital. Nothing about Leah stood out, except for one thing: the look on Dr. William Daniels' face when he saw her name on the chart. Dr. Daniels, a well-known pulmonologist in the area, had built his career treating high-profile patients, rubbing shoulders with doctors from prestigious institutions. He didn't deal with people like Leah. He wasn't used to patients who didn't look the part. Leah was young, black, and wore a simple hoodie and jeans, far from the polished professionals he was accustomed to seeing in his office. In his eyes, she was just another low-class patient, someone he had no patience for. As Leah sat in the waiting room, flipping through a magazine to distract herself, Dr. Daniels walked past the receptionist and went straight to the back. He saw Leah's name on the chart and his eyebrows furrowed. He didn't want to treat her. He thought she wasn't worth his time. "Can you just send her back to a general practitioner? I don't have time for this," he said, barely glancing at Leah's medical file. The receptionist hesitated for a moment, but nodded, making a note in the system. Leah, unaware of what had just happened, sat there, waiting her turn. She wasn't expecting anything special. She just wanted to feel better. When the nurse called her name, Leah stood up, following the nurse to an examination room. The nurse smiled and told her it wouldn't be long, and soon enough, Dr. Daniels walked in with a clipboard in hand. His expression was cold and distant, and Leah immediately felt the tension in the room. "So, what seems to be the problem?" he asked, his tone sharp. Leah explained her symptoms, describing the cough, the fatigue, and the chest tightness. But Dr. Daniels didn't seem interested. He barely made eye contact, instead jotting down notes on his clipboard. Leah noticed how he kept glancing at the clock, as if she was wasting his time. "Well, I think you should just take some cough syrup and rest. I don't see anything serious here," Dr. Daniels said dismissively, almost as if he were ready to move on to the next patient. Leah felt a knot in her stomach. She had been dealing with this cough for over a week, and now, here was a doctor telling her it was nothing to worry about. She wasn't satisfied with the answer, but she didn't want to make a scene. "I don't know, Doc. I've had this cough for a while, and it's getting worse," Leah said, her voice slightly shaking with frustration. Dr. Daniels sighed. "Look, you're young, you're healthy, you don't need to worry. Coughing is common." He turned to leave the room, clearly uninterested in hearing more. Leah, now feeling dismissed and frustrated, reached for her phone and shot a quick text to her father. Thomas Carter was a well-known businessman, a self-made millionaire, and, more importantly, the owner of the very hospital Dr. Daniels worked for. "Dad, I'm at the clinic, and I'm not happy. The doctor is acting like I'm wasting his time. He barely listened to me and just gave me some cough syrup. Can you call?" Leah hit send, hoping that her father would step in and make sure she wasn't being treated like this for no reason. She had never expected to feel this way at a place her father had built, a place that was meant to help people, regardless of who they were. Meanwhile, Dr. Daniels continued his rounds, barely thinking about the girl he had just seen. He had written her off as just another kid who didn't know how to deal with a simple cold. He had no idea who Leah was, nor did he care. But that was about to change. As Leah waited, still feeling uneasy, her phone buzzed. It was a message from her dad. "Don't worry, honey. I'm calling the hospital right now. You deserve the best care. Just hang tight." Leah felt a sense of relief wash over her. Her father was always there for her, no matter what. But little did Dr. Daniels know, the person he had just dismissed was someone with a lot more power than he could ever imagine. When Thomas Carter called the hospital, he made it clear that Leah wasn't to be ignored or treated poorly. He wasn't going to let anyone, especially not a doctor, disrespect his daughter. It was the kind of call that would change everything for Dr. Daniels, though he had no clue just yet. Leah sat there, waiting for what came next. She tried to calm her nerves, hoping her dad's call would make a difference. But what she didn't know was that Dr. Daniels wasn't just going to apologize. He wasn't going to admit that he had made a mistake. And so, the stage was set for a clash between privilege, power, and the harsh realities of discrimination. Dr. Daniels had no idea that the girl he had just treated like a nobody was about to turn the tables on him in a way he would never forget. Dr. William Daniels was in his office, casually reviewing his patient notes, when his phone rang. It wasn't unusual for him to get calls throughout the day, but this one felt different. The name that popped up on the screen was one he knew well, Thomas Carter, the owner of the hospital where he worked. Dr. Daniels had always been careful around the hospital's higher-ups, but he didn't expect this call to be about anything serious. "Hello, Dr. Daniels," Thomas Carter's voice came through, steady and confident. "I just got off the phone with my daughter. It seems you didn't take her symptoms seriously today." Dr. Daniels froze. He had no idea what was coming, but the calm, almost casual tone of Thomas's voice made him nervous. "Mr. Carter," Dr. Daniels stammered, trying to recover his professionalism. "I wasn't aware your daughter was a patient here today. It's standard procedure to treat everyone with the same care." Thomas cut him off, his voice colder now. "I understand, but my daughter isn't just any patient. She's my daughter, Dr. Daniels, and from what I hear, you treated her as if she didn't matter. You dismissed her concerns like she was some random child off the street. Is that how you treat all your patients?" Dr. Daniels struggled to find the right words. He had been wrong. He could admit that now. But what could he say to fix it? He tried to explain, but Thomas wasn't having any of it. "Listen, I don't need excuses, Dr. Daniels. My daughter is a young woman who came to you for help. When she tells you she's not feeling well, you don't brush her off. Do you understand that?" "I do," Dr. Daniels said quickly, his voice shaking now. "I'm sorry. I didn't know it was your daughter. You should have done your job," Thomas interrupted, his voice sharp. "I'm going to make sure this is handled. You're not just going to treat my daughter like that and get away with it." The line went silent for a moment, and Dr. Daniels' heart raced. He realized now that Leah wasn't just another patient, and that his mistake had just cost him. The gravity of the situation hit him. If Thomas Carter was involved, there was no telling how far this could go. His career could be on the line. I'll make sure she's seen again. Personally, I'll correct the mistake, Mr. Carter," Dr. Daniels stammered, now fully aware of the weight of his error. "You'll do more than that, Dr. Daniels. I expect an apology, not just to Leah, but to everyone who's been affected by this. And I want you to review your attitude toward patients. You may be a doctor, but that doesn't make you better than anyone else." Thomas hung up without saying another word. Dr. Daniels stood there, holding his phone, feeling the sting of his mistake. He wasn't used to being called out, especially not by someone as powerful as Thomas Carter. But this wasn't just about his pride, it was about his job, his reputation, and his future. A few hours later, Dr. Daniels walked back into the clinic, feeling the weight of the day on his shoulders. He couldn't shake the memory of Leah's face, the way she had looked at him when he dismissed her. She wasn't angry or shouting, she was just calm, too calm. It was as if she knew something he didn't. The realization had hit him late in the afternoon. Leah Carter wasn't just another patient. She was someone who had the power to make him pay for his mistake. When Dr. Daniels walked into the room to speak with Leah, she was sitting quietly in the corner, her arms crossed. Her father's influence was clear now. The moment Dr. Daniels entered, he could feel the change in the air. Leah had already sent a message to her dad, and now she wasn't going to let Dr. Daniels off the hook. "I'm sorry," Dr. Daniels said awkwardly, standing at the doorway, unsure of how to proceed. "I didn't realize who you were. I should have taken your symptoms more seriously." Leah didn't respond right away. She simply stared at him, her expression unreadable. After a few seconds of silence, she stood up and walked over to him. "You should never have treated me like that in the first place," she said, her voice calm but firm. "My dad might have given you a chance to make things right, but it's not about him. It's about you doing your job properly, no matter who walks through that door." Dr. Daniels felt small. He wasn't used to being called out, especially not by a young girl. But there was something in Leah's voice that made him realize just how wrong he had been. "I understand, Doctor," Daniels said quietly. "I'll do better. I'll make sure this never happens again." Leah nodded, satisfied with his response. "You don't need to apologize to me," she said, her tone softening. "Just make sure you don't make assumptions about people based on how they look or where they come from." Dr. Daniels nodded, realizing that he had learned a valuable lesson. It wasn't just about doing his job, it was about treating everyone with the same respect, regardless of who they were. Leah didn't need his apology, but she needed him to understand that his actions had consequences, and when the powerful and the privileged stood up for what was right, they could make sure that others were treated with dignity and respect. As Dr. Daniels left the room, Leah sat back down, feeling a sense of peace. She had stood up for herself, not because she had to, but because she deserved better. And she knew that things were going to be different from now on, at least in this hospital. The encounter wasn't just a lesson for Dr. Daniels. It was a reminder that sometimes power wasn't just about wealth or status. Sometimes it was about standing up for yourself and making sure the world knew you were more than they thought. As Leah left the hospital later that day, she felt proud. It wasn't just about getting the treatment she needed. It was about making sure that no one would ever again treat her or anyone else like they didn't matter. And for Dr. Daniels, the realization came too late. He had learned his lesson, but the consequences of his actions were far from over.